A tick bite-associated allergy is an emerging clinical and public health concern. That's according to the Centers for Disease Control. It's called alpha-gal syndrome, or AGS. The illness can cause a person to have mild to severe allergic reactions after consuming red meat, dairy products, or some pharmaceuticals. What's concerning to medical authorities is that there's little known about AGS, and nearly half of U.S. clinicians have never heard of it, and there's no cure. So far, evidence shows reactions most associated with bites coming from the Lone Star tick. This is the most common type of tick found in Alabama. The CDC recommends wearing bug repellents and checking the body and clothes to avoid being bitten.
Maybe you've heard of this, maybe not. I had not until yesterday. It slithers like a snake and resembles a piece of whole wheat spaghetti, but it is a worm and it has a uniquely shaped hammerhead.
That is oddly specific.
Yes, very, very specific.
Holly joins us from the newsroom with more on what entomologists are calling a creepy creature. Yes, Holly?
No, the whole thing's just making me nauseous. When I just heard Steve explain that, I'm like, ugh. But we are indeed talking about the hammerhead worm. It's an invasive flatworm from Asia, and according to the Washington Post, it's spreading to new locations, that is, through the exportation of exotic plants. There have been a handful of sightings across the D.C. area. Over the past 15 years, Virginia has seen 248, Maryland over 91, and D.C. just 16. Now, there's no effective yard treatment for the worms. Handling the hammerheads can cause skin irritation.
A new letter from the CDC says Florida is one of the states with the most new leprosy cases in the country.
West 2's Marlene Martinez spoke with a doctor and tells us which Central Florida county has been seeing the most cases over the last decade.
There definitely is leprosy in the United States. Now, most of it is imported, but we do have homegrown leprosy here, principally in Texas and Florida.
For many, leprosy may seem like a problem from biblical times, but Dr. Nicole Iovine, the chief hospital epidemiologist at the University of Florida, tells me the disease is very much still around. In fact, leprosy could now be endemic in Central Florida.
Endemic means something that is circulating and is present at all times, and it can be at a low level.
According to a new research letter from the CDC, Florida is among the top states with the most new cases of leprosy. That's based on data from 2020, the latest research data available. So far this year in Florida, there have been 15 confirmed cases of leprosy according to the state, and most of those cases are in Brevard County. In fact, Brevard has seen the most leprosy cases in Florida since 2011. And in 2020, Brevard accounted for over 12% of all leprosy cases in the country. So what happens if someone has leprosy? Dr. Iovine says that usually means lesions on the skin.
If you have something that's like, a few centimeters on your arm and you can't feel it, that's going to be different from a typical rash, which is going to be itchy or some other way that you would identify with a normal rash. So it is distinct. It can be extremely disfiguring, though. So it definitely causes a lot of distress.
So how does someone contract leprosy? Dr. Iovine says usually armadillos are to blame.
Physical contact is really what you need. You need to have physical contact with an infected armadillo.
Dr. Iovine says, fortunately, antibiotics are very effective at treating leprosy. In Orlando, Marlene Martinez, West 2 News.
Dallas County reported its 5th case of West Nile virus today. The patient had the more serious neuroinvasive version of the disease. So that more serious illness has been diagnosed in nearly every confirmed patient so far this year. Fox 4's Rebecca Butcher in Dallas with this story. Rebecca.
Heather, yes, that's right. That makes 5 cases today of the West Nile virus. The number of cases has already outpaced last year.
It's crazy because it's so dry, so hot, but mosquito activity remains high, and specifically due to the summer season. We know that during this time, that's when mosquito activity remains very high.
So far this year, the Dallas County Health and Human Services reported 5 cases of West Nile virus in human patients. 4 out of the 5 are the potentially deadly neuroinvasive form of the disease.
One affects the brain, the other one doesn't. So this situation for this particular case is West Nile neuroinvasive case. So that means it affects the brain.
According to the CDC, the neuroinvasive form of the virus only develops in about 1% of the people who contract it. Most people who contract it may not notice symptoms at all, so it's likely many cases don't get confirmed.
People should monitor their symptoms. A lot of times we ignore mosquito bites, and we think that it's just a mosquito, nothing's going to happen, but we just don't know.
This season, nearly every confirmed case has been neuroinvasive disease. Cases reported in Tarrant and Denton County this month were also the more serious version of the disease.
This is just a concerning amount of cases because mosquito activity remains high in Dallas County.
Dallas County Health and Human Services says traps are set out all around the county. They are monitored daily to see if mosquitoes are carrying the virus. If they are, the area gets sprayed.
If there is a case, a human case, we report it out to the community, and we advise anyone if it's affected by West Nile virus to seek medical attention immediately. But we're seeing an increment in cases for sure.
Health and Human Services strongly recommends taking precautions when you're outside, especially at dawn and dusk when mosquitoes are more active.
Wear that repellent that contains a DEET component. Second will be to wear long sleeve clothing to prevent mosquito bites. Light color clothing will be best.
And Dallas County reported just 3 human cases of the West Nile virus last year, although one of those did end in a death.